All right, joining us now is the PRO, Nigeria Health Association of Public Health Physicians of Nigeria, Dr. Akin Abayomi. It's nice to have you join us
this morning.
Nice to see you.
Same
Great.
here.
Now, if we measure the level of panic, it has reduced now with the level of awareness going on generally. But we still have to talk about the precautions. Are we doing enough as a government and as a people?
Okay, most of the precautionary measures actually lie in the individual citizens, those that actually go out to ensure management of institutions, to ensure that their institutions, their areas are adequately provided, because the preventive measures are mainly personal, ranging from the washing of hands and respiratory hygiene. So the bulk of it actually lies with us as individuals. The part of government or part of people in authority could include things like ensuring that there is water, because if you don't have adequate water supply, then you cannot wash your hand effectively. So that's a part that lies in the hands of maybe some authorities. But however, communities too can rally around. Even if you don't have good water system in your community, or even a school, you don't have water, there are makeshifts, there are alternatives that you as individuals or you as a group of people can actually come together and try to ensure that you have water, so that you ensure hand washing, which is the basic measure and can go a very long way, is ensured.
Now, the market, like our focus is a complex place where everybody and anybody walks into the market, and you know how transactions take place. How complex would it be taking precautions to, you know, when you're talking about containing the spread of coronavirus in such a place?
Unfortunately, a large number of our markets here in Lagos and even in Nigeria are not so organized. Ideally, markets should be organized in which you have a separation of maybe where they sell live animals, animals that are caught and slaughtered, from where you have ready-to-eat food like vegetables and all. So currently, we do not have a lot of markets that are organized. So we need to try to come up with a system in the long term to organize our markets better. But in the meantime, currently, what can be done, because the general precautionary measures are still the hand washing and respiratory etiquette, cough etiquette, education of the market women, carrying the earlodgers around so that we can educate them properly on some of those preventive measures. And as I said, ensuring that we have good water facility, sanitary facilities, have a toilet facility even in the market, away from where you sell food. Separate your raw food from the uncooked food, food that are actually ready to eat, and ensure that they have water to wash their hands. That's very, very important. The market women should be educated well enough to know. They need to be educated, more education, more sensitization to these women in the markets to ensure that they are aware that this coronavirus exists. Crowded stalls, they should have a way of either spacing them out, adequate lighting, even their general environmental measures should actually be put into consideration. Their disposal of waste. Waste should be disposed from the market daily, ideally. And because there has been a link to wild food markets in Wuhan, China, although their own food, the animal that is being queried is an exotic animal and not an animal that we are likely to have here in Nigeria. But there are other infections apart from coronavirus, like the Lassa, which markets plays a major source in transmitting.
Now, the mode of transmission still remains some of the primary ones that you talk about, and is still person-to-person transmission, which everybody's taking caution about. But we still find, despite the level of awareness, we still see people looking for face masks, even when WHO and all those who are concerned are saying that if you don't feel sick, you don't need the face mask.
So it's more sensitization, sensitization on social media, online, print media, TV stations, media stations, to let people know that the mask is only for those that are ill with symptoms, coughing, or those that are taking care of people that are actually sick. They are the ones that actually need the mask. Because what is happening globally is that we are now having a shortage of masks by those that actually need them. So even the healthcare workers are not even having easy access to this mask because of panic buying and people storing stuff like that at home. So we need to continue to educate and sensitize the public. That's the best anybody can do at this point in time.
All right. In South Korea, there is even a regulation as to how many masks one person can buy at a time.
Can we have that here in Nigeria?
No. Anything is possible. All right, Dr. Akin Abayomi, thank you so much for coming.
Thank you for having me.
Thank you.
Joining us now is the PRO, Nigeria Health Association of Public Health Physicians of Nigeria, Dr. Akin Abayomi. Good morning.
Good morning.
Thank you for joining
Nice
us.
to have you.
Yeah.
Great.
Well, we're focusing on the markets, and for Lagos State or Nigeria, containment is a major concern at this point. And we see that in some countries, they are limiting the use of banknotes. And if we say in the markets, we want to limit the use of banknotes, not every market woman has the POS machine and all of that. We have the challenges with transfers and all. If we get to that point, some will say we haven't gotten to that point. How do we handle this?
Okay, you're right. We haven't gotten to that point, so we would not want to create any panic among our market women.
Absolutely.
Yeah. So, but when we get, if at all, we hope not to get to that point, but if we get to that point, then we'll advocate for more preventive measures. So this market women, we can advocate that they use, we have what we call the nylon gloves. Those are very, very much abundant in circulation, which they can use to protect themselves. Even ideally, when handling anything related to food, because of the high incidence of foodborne illnesses, usually a market woman should ideally, a market woman that deals with live animals should ideally use rubber gloves as a form of protective, personal protective measure, yes. But in terms of banknotes and handling cash to customers, because most of them, what you notice is that I finish cutting my meat or even fish that has blood or any body fluid in it, and they bring out the change from their apron or whatever, and it's stained with the blood. So that's really, really hazardous to the health of the consumer, the person actually buying this product. So protective measures that they can use, which they can employ, is the use of gloves. Another alternative is the water supply. You know, we cannot overemphasize washing our hands adequately, but then you would say that our markets are so crowded, would you stand up, go to the restroom to wash your hands? But there are makeshift measures, there are alternative measures. We have, I don't know if you've noticed this bucket that has a tap attached to it, which you can just put next to your stall, and it has water, and the water collects into another bucket below.
But you understand how our markets are. It's
crowded.
Not as it's crowded and not as structured as it should. So every space has been utilized, have been taken over.
Every space is a shop.
Has been taken over by the shops, by wares, and all of that. Will
Which
that really
in the
work?
mid-term is something that would try those in charge of structuring markets to actually try to correct and organize our markets better. But in the meantime, whatever small space you have, because your health is also important, and because you are selling this food to many people, the health of the population is also actually important and somewhat in your hands. So you need to find a way to ensure that your hand hygiene is optimal. I would have said the use of hand sanitizers, but that's not really ideal in a market setting, because you're sanitizing your hand. If you use it regularly, you're not even supposed to use alcohol-based sanitizer too frequently on the hand, because it can cause cracks, and you're also touching food items as well. So hand washing is still the optimal way to prevent yourself and to prevent your consumers and people that are buying products from you in the markets. So a way has to be found around it for you to wash your hands.
We see from some of the reports and even videos from some of the countries where they do public fumigation and cleaning of environmental public places like lifts, escalators, elevators, stadium, and all of that. Has Nigeria come to that level where that could be considered?
Well, that could actually be considered as a proactive means, like be a proactive preventive measure. And since we're focusing on the markets today, we have this cadre of workers. They're the environmental health officers. So they are actually in charge of going to markets. They are ideally meant to, which I think they do, carry out market inspections every week, every Thursdays. That's why we have the market sanitation days. So they inspect markets, they inspect their drainages. Anytime they find out that we have invasion of pests of any sort, then they come up with the measure to ensure that they eradicate the pests. But right now, in the era of coronavirus infection, our major, as epidemiologists, the major form of transmission is still the human to human. We haven't, even worldwide, globally, they haven't really been able to link it to any particular animal, despite the fact that the origin is zoonotic, meaning transmitted from animal to man, but the animal to human. But the exact species of animal or vector has not really been isolated. But proactively, our markets have to be clean. That cannot be overemphasized. Apart from corona, I'll keep saying there's still Lassa, and rats are the major culprits. So we need defumigation measures on a regular basis. But the environmental health inspectors, the health officers, they're in charge of that. They go around. When they feel the market needs to be defumigated, they do that.
All right, Dr. Akin Abayomi, thank you for speaking with us.
Thank you for having me.
But joining us now is the PRO, Nigeria Health Association of Public Health Physicians of Nigeria, Dr. Akin Abayomi. Thank you for joining us.
Thank you for
You're
having me.
welcome.
Thank you.
All right, we see that China has, so to speak, cracked down on Wuhan, the market, talking about the market animals, seeing that this coronavirus is said to be zoonotic in nature. It moves from animals to humans. And some are saying that perhaps we should be taking this step as a preventive or proactive measure by the government, cracking down on wildlife market and perhaps any market that has to do with the sale of animals.
Okay, to the best of my knowledge, I know Lagos State has the meat inspection units where they inspect any form of wildlife or animal that is being brought in and slaughtered. I'm not aware that we import exotic animals in Nigeria as of now, but we have a lot of bush animals which also could also be they are being sold, and it could be, and they're not even sold in organized markets. Most times we find them selling them on the highway express, which could be a risk to us as well, because these animals cross-breed, and also you could have different strains of these animals that could have different strains of the viruses. So I think, first of all, the ones not in organized markets need to be regulated. We shouldn't have anybody coming out on the express selling a strange animal which we do not even know the source of the animal or what animal it is. They categorized all of them as bushmeat. During Ebola time, it was linked as a source of the virus at that time. And also when we had the monkeypox also, the bushmeat was linked as a source. So that's market, that informal market of selling strange animals should actually be regulated. If it cannot be curbed totally, but there should be a way of regulating it. Then for the organized markets, good enough, we have our meat inspectors. They go around regularly and inspect slaughterhouses. They inspect these cows, because if you remember, we've had so many pandemics worldwide. We've had the mad cow disease, we've had the swine flu, we've had the avian flu, all sorts arising from animals. Our vet health authorities, we have veterinary doctors who are also public health specialists. They also go around to ensure that animals are not sources of infection. They are investigating them regularly. So for the zoonotic aspect, which is the transmission of infection from animals to humans, the veterinary public health inspectors are there, the meat inspectors, even the environmental health inspectors, because we cannot avoid talking about the environment in which even these animals come in contact with themselves, because they could also transmit the infection to themselves before they eventually transmit to man.
All right, Dr. Oluwatoni Adeyemi, we'll have to leave the discussion at this point, but thank you so much for your insight on the topic.
Thank you very much for having me.